Welcome back, Focus Learners. We are diving right into this high-yield explainer today. If you're looking for that comprehensive overview to prep for your NSG 331 Week 12 quiz on chapters 26 and 28, well, you are in the exact right place. I'm absolutely thrilled to guide you through this material. We're going to structure your notes, laser focus on the most testable concepts, and make sure you absolutely ace this upcoming quiz. Okay, let's jump right in. Here is our study roadmap. We've chunked these complex chapters into 6 highly testable buckets: life transitions and families, transitioning to chronic illness, understanding intimacy and touch, sexuality and special circumstances, physiological changes in aging, and we'll wrap up with a quiz review to test your knowledge. Starting right off with Section 1, Life Transitions and Families. This is all about the social changes and role adaptations older adults face.
For the exam, you've really got to understand that retirement is not just a single one-and-done event. It's a complex, evolving emotional journey. Think of it kind of like a roller coaster. It starts with a pre-retirement stage and then often shoots right up into a euphoric honeymoon stage. But it doesn't just stay there. A lot of older adults will hit a disenchantment stage before they start figuring things out and reorientation. And finally, they reach a stability stage. Knowing this fluctuates is just absolutely crucial for providing empathetic care. So, what's your role as the nurse during this massive life shift? I want you to mentally highlight 2 things right now: provide anticipatory guidance and advocate for quality of life policies. These are highly testable. You aren't just there to treat physical illness, right? You're there to help them plan, to spot risks like a sudden drop in income, and to connect them with counseling and resources way before a crisis actually hits. Now, understanding who exactly makes up a patient support system is a huge deal. Have you ever heard the term fictive kin? These are non-blood kin who serve as, quote, genuine fake families. As traditional family structures shift, these friendships become an incredibly vital source of support, promoting real health and resilience. And here's a really beautiful takeaway for your own clinical practice. Nurses and primary care providers can actually become fictive kin to their older patients. How cool is that? Let's shift our focus over to Section 2, transitioning to chronic illness. We're looking at the physical shift many elders make from overall health to managing ongoing conditions. To put this into perspective, an overwhelming 80% of adults over 65 have at least one chronic condition. 80%, and 68% have 2 or more. For your quiz, lock these top 3 in your brain. Hypertension is the heavy hitter at 58%, followed by high cholesterol at 47%, and arthritis at 31%. How well a patient adapts to these depends heavily on the severity, how many issues are compounding at once, and how fast their health is changing. Because these physical transitions are incredibly overwhelming, your role is super clear. Whether the decision is a simple everyday thing, like choosing if they prefer a bath in the morning or the evening, or a major life-altering decision, like ensuring access to providers, or understanding a complex procedure, your mandate is unwavering. You are their advocate, always. You have to involve them in their own decision-making. It gives them back that critical sense of control over their illness. Moving right along to Section 3, understanding intimacy and touch. This explores a really vital, but honestly often overlooked human need for physical connection. When prepping for the quiz, make sure you know the difference between the outer social zone, which is just the hands, arms, shoulders, and back, versus the inner, far more sensitive zones that absolutely require consent, like the vulnerable and intimate zones. Older adults frequently tell us they miss being touched or held, especially after losing a spouse. As a nurse, you've got to be aware that while touch can be deeply healing, a patient's response is totally dependent on their culture, their age, and their personal life experiences. Which naturally leads us right into Section 4, sexuality and special circumstances. We really need to look at the broader concept of sexuality here because it's so much more than just physical intimacy. Sexuality is essentially the total expression of who a person is. It's like a giant puzzle where biological, social, psychological, and moral factors all intersect. The source material emphasizes that this is an essential need at any age. We never age out of the fundamental human need for intimacy and belonging. It leads to feelings of pleasure and well-being, and yet that absolutely includes our older adult populations. But we have to talk about the unique challenges you'll definitely see on the exam. In long-term care facilities, the biggest hurdles are usually a total lack of privacy and, sadly, judgmental attitudes from staff or even family.
With dementia patients, nurses face incredibly complex challenges regarding a patient's cognitive ability to consent, as well as managing sexually inappropriate behaviors. And finally, remember that LGBT older adults face a double stigma, being both older and homosexual. This puts them at a high risk for discrimination, making them way less likely to access the health services they need. You need to be that safe, effective link to community resources for them. All right, let's get into the hard biology. Section 5, Physiological Changes in Aging. Pay close attention here, guys, because this is historically a highly testable area for the quiz. Let's start with a definition you're very likely to see, maybe on a matching or multiple choice question. Perimenopause. This is the time where reproductive function gradually ceases. Notice the time frame. It typically hits between the ages of 48 and 55. And just to be clear, this is the phase that precedes menopause, which is the permanent end of menses. During this perimenopausal transition, there are several key symptoms you need to memorize. Chunk them into 3 categories. First, physical symptoms like vasomotor instability. Think night sweats, hot flashes, and headaches. Second, emotional symptoms like major mood changes, irritability, or anxiety. And third, sensory changes. This one is really interesting, an altered perception of touch. This can actually present as numbness or literally avoiding being touched altogether. Another critical vocabulary word for your exam is dyspareunia, meaning painful sexual intercourse. Biologically, as women age, estrogen decreases. That drop in estrogen leads to a shortening, a narrowing, and a much thinner epithelial lining of the vagina. As the nurse, you've got actionable steps here. Recommend longer periods of foreplay, over-the-counter topical lubricants, or even talk to the provider about a prescription estrogen cream. Switching gears to male physiology, let's look at erectile dysfunction, or ED. For most older men, actually, scratch that. It's not just a normal part of aging. It's almost always caused by underlying medical diagnoses. Look for systemic issues like vascular, endocrine, or neurological problems, and a big one for the test is diabetes mellitus. Lifestyle factors like alcoholism play a major role too. But crucially, as a nurse, watch their med list. SSRIs, diuretics, and antihistamines are huge common culprits of ED that we need to be monitoring. Okay, you've absorbed a ton of fantastic information. Now it's time for Section 6, Quiz Review. Let's get our brains fired up for the interactive part of this explainer. We're going to use actual potential questions to actively test your comprehension. Ready? Here is knowledge check number 1. To promote positive role transitions in an older adult, what should the nurse realize? I want you to just pause for a second. Think back to the underlying principles of aging we talked about in the very first section. What is the one universal truth about adapting to new phases in later life? Did you get it? The answer is, at some point, all older adults will need to cope with loss, whether it's losing a career through retirement, losing a spouse in widowhood, or losing physical ability when transitioning to a chronic illness. Loss is literally a universal part of aging. When we acknowledge that, it allows us to provide truly empathetic, anticipatory guidance. Let's try another one. The nurse admitting a married couple to a long-term care facility best acknowledges the couple's sexual health by asking, think about your clinical communication skills here. We talked about sexuality in places like long-term care, where privacy and staff attitudes are huge barriers. How do you bring this up without making it weird or uncomfortable? Well, you would never, ever ask a highly invasive question like, what types of sexual activities do you enjoy? No way. Instead, the correct open-ended approach is simply, do you have any sexual concerns related to your being here? This just brilliantly illustrates your mandate to be non-judgmental, respectful, and an advocate for their holistic needs. It opens the door for them to share, but totally without pressure. So we've covered the most highly testable material from chapters 26 and 28. But I want to leave you with one final provocative thought straight from your source material. What is the actual difference between loss and grief? As a final step in your quiz prep tonight, I really encourage you to define those two terms on your own. Understanding the physical event of loss versus the emotional process of grief will absolutely elevate your nursing practice to the next level. Thank you so much for joining me for this explainer. Stay focused, study hard, and you are for sure going to do great on that Week 12 quiz.